Everyone, we just wanted to let you know we're running a few minutes late. We're waiting for one more person who's on their way. And so, and there's Amit, thank you. And so we should be starting hopefully in the next 5 minutes or so. Yeah, you'll call to order the meeting.
Yeah.
But yes.
Good afternoon, everyone. Today is March 27th, 2024, and it is 4:07 p.m. As a quorum of the committee of the Budget and Finance Committee is in attendance, I would like to call to order the meeting of the Central Health Budget and Finance Committee. As a reminder, some of our committee members may be also participating by video conference. Believe Manager Matwani is on. Okay, there you go. Thank you. So the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. Members, we will be taking public communication for all three meetings now, for the Budget and Finance Committee, for the Executive Committee, and for our Board of Managers meeting as well. And as members of the public who wish to make comments virtually during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 2:30 p.m. of today. As part of our public communication, we will continue with our Mission Moments series. With these brief presentations, staff, patients, or community members will share with us stories of how our mission is connecting people to healthcare and health coverage, and giving them an opportunity to live healthier as Central Health builds a better healthcare system for Travis County. Because March is Women's History Month, we would like to take the time to highlight the contributions women have made in the Austin community. So with that, Yesina, can you please introduce our speakers for this evening?
Thank you, Madam Chair. So I will now read the guidelines for this meeting's public communication, since we do have a few members signed up for public comment as well. So they'll be wrapped in with the mission moments. When called upon to speak, please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number after your introduction. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted or asked to stop speaking. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. We received 6 submissions for public comment and/or mission moments. Our first speaker is Mark McKim, who is here in person with us.
Hello. Good evening, Central Health Board of Managers. It's my first time here, so I'm a little nervous. My name is Mark McKim, and I have worked as a social worker and educator in Austin for over 11 years. First, thank you to this board and especially all Central Health staff for providing vital healthcare services to our most vulnerable neighbors in Travis County on a daily basis. I personally have benefited from Sendero Ideal Care health insurance plan and have been a patient at community care clinics for 5 years. So I really mean it. Thank you for contributing to my physical and mental well-being, as well as thousands of others of my neighbors. I come to you today to ask that you consider listing the salary range for all Central Health positions on your job board. As Central Health strives to attract top talent and foster a culture of fairness and equity, listing salary ranges in job descriptions is critical. First, transparency fosters trust and establishes a foundation of fairness. When organizations openly communicate salary ranges, they demonstrate a commitment to equitable compensation practices. Prospective employees feel empowered, knowing what to expect financially, which leads to a more positive candidate experience. Moreover, through the lens of equity, transparency in compensation can help mitigate the risk of pay discrepancies based on gender, ethnicity, or other biases, thus promoting diversity and inclusion within the workforce. Second, listing salary ranges enhances efficiency in the hiring process. When we provide clear information up front, we reduce the likelihood of candidates applying for positions that are not aligned with their salary expectations. This saves time for both the applicants and hiring managers, streamlining the recruitment process and allowing resources to be allocated more effectively. Again, through an equity frame, this is uniquely salient when it comes to middle income roles, as we all know one of the unique disparities between higher and lower income earners beyond the currency of dollars is the invaluable currency of time. Transparent salary disclosures also align with broader societal trends towards openness and accountability. By disclosing salary ranges, organizations demonstrate a commitment to accountability and ethical conduct, which enhances their reputation. Furthermore, transparent salary practice contribute to a culture of trust and collaboration within the organization, fostering employee loyalty and engagement. To close, the practice of listing salary ranges in job descriptions is a proactive step towards building a more transparent, equitable, and efficient organization. By embracing transparency, Central Health can enhance trust, streamline the hiring process, and maintain a competitive edge in attracting top talent, while advancing an equitable ethic of integrity. Thank you for allowing me this forum to suggest that Central Health adopt transparent salary disclosures in their job descriptions as a fundamental component of its recruitment strategy. And just on a personal note, one reason that prompted me to want to come today to say this is I have been applying to positions at Central Health, and they're not listed. And even when I went to the Central Health job fair, many of the people at the different
30
booths
seconds.
were unsure of what the starting range was. So it was hard for me to kind of know where to go exactly, because there's a lot of unique positions that are not necessarily doctor, nurse, medical assistant. So those positions are definitely
Thank you.
helpful to have that.
Thank you.
Public. Thank you.
Unfortunately, we
I
cannot-
didn't hear the beat. Was there a beat?
Okay.
Oh, okay. All right.
Yeah.
Thank you all so much.
Unfortunately, we cannot comment because it's not posted, but we will definitely take that into consideration.
Chair, can I make a request?
I don't,
I'm not gonna, it's not to talk with him. If you could just share your comments and send them to us, that would be great.
Thank you.
Or send them to our staff and they'll,
An email, board.
Mark,
you.
feel free to email them to me and I will make sure that the board members receive it. Thank you so much.
thank you. Next speaker.
Up next, we have Tara Trower, Chief Strategy Officer for Community Care, and she's here in person with us.
Welcome.
Welcome. Is it on?
Yes.
Okay. Thank you for having me today. I don't usually come in person for public comment, but I did want to take a few moments to let you know some details around an operational change. Usually we don't bring these to you, but this one might be more visible than others. The RV that was purchased by Central Health in 2018 to help deliver care to Creedmoor and Colony Park specifically while we work to open those new facilities, we are decommissioning it. It was bought used and really has reached end of life. In the past 2 years, it's been down 72 days. And we have been advised that getting parts is going to be more difficult. One of the things that we are doing is taking the opportunity to actually expand access in the Eastern Crescent, taking part of the team to move Hornsby Bend, which we've only been doing clinical services 3 days a week. We'll be going to 5 days a week. The added efficiency will create 84 additional patient slots because we take out travel time. At Creedmoor and at Colony Park, we will not be in Barbara Jordan. We are going to be using the Northeast Resource Center, which has been the backup location for those patients when the RV goes down, to provide a 5-day-a-week telehealth kiosk, as well as a team member to assist individuals with that. We also, at Northeast, will have a provider team there on the normal schedule, but it is certainly reduced in the sorts of things that we can see versus what we were able to do in the RV. And then we will have a similar telehealth component in Creedmoor as well. The world has changed since 2018. We have Lyft now, we have Z-Trip. We have opened or purchased additional sites. So nearby, particularly Colony Park, we now have a women's health practice. We also have Carousel. We have the Black Men's Health Clinic, all in relatively close proximity, not as close to folks in that community, but feeling like this will open up access until Colony Park can be programmed and planned. So just wanted to let you guys know about that. Our board approved the change and removal from scope at their board meeting last night. And we're required to have them vote and approve when we take items in and out of service. And so just wanted to let you guys know.
Thank you.
Thank you, Tara. Up next, we have Helene Black, who's the Executive Director of Black Mamas ATX.
Welcome.
Good afternoon, everyone. So, yes, hi, my name is Kelly Blake, and I'm the Executive Director of Black Mamas ATX. As we wind down to the end of Women's History Month and World Doula Week, I'd like to share some of the impactful work being done here in Austin related to women's health and maternal mortality, and the continued support needed in this area. Black Mamas ATX provides no-cost doula support to folks who are Black and pregnant in Central Texas. Doulas are trained non-clinical professionals who provide continuous physical, emotional, and informational support to their clients before, during, and after childbirth. They support birthing folks at hospitals, birthing centers, and home births. Doulas are not midwives, they're not clinicians, and yet doulas have been shown to have a positive impact on birth outcomes, particularly in the Black community where disparities persist. Our organization has worked with Central Health to establish a doula program in which one of our team doulas specifically works with Black community care patients, providing doula support, which I'm pleased to report is going strong. At Black Mamas ATX, we know that our doulas have saved lives by listening to our clients and helping them to advocate for themselves when they are not being heard by their healthcare providers. I have a video that shows some of what our clients have to say. Please, could you play the video?
Why I love Black Mamas ATX is because they made being pregnant during a pandemic way less scary.
My doula served as a community for me during a very trying time.
As a Black mom, they're there for me not only while I'm carrying the baby, but also after the baby comes.
How important and beneficial it was to have somebody in the room with me that day who was able to advocate for me.
I just love the support, the extra voice that I had. They advocated for me.
Black Mamas ATX is helping to make sure that Black mamas not only survive, but thrive.
Thank you. Doulas also support healthcare teams. Oh, I hope you can hear me. Doulas also support healthcare teams by being present with clients, explaining medical terminology or situations so clients can give informed consent, and working with medical staff to ensure the care given is truly patient-centered. My call to action is for Central Health to expand its support for doulas and doula organizations to make this essential service available to more of our birthing community. Additionally, we need clearer data and more accountability from local healthcare providers and
30
hospital
seconds.
systems around the health outcomes and disparities that exist at the local and hyper-local level, so that our healthcare providers and community-based organizations will know where to focus our efforts to have the greatest impacts. Thank you.
Thank you so much. Appreciate it. Our next.
Thank you, Ms. Blake. Up next, we have a mission moment by Dr. Himali Patel, Director of Transitions of Care for Central Health.
Good evening, everyone. This is my mission moment. Firstly, I would be remiss if I didn't take a moment to recognize the incredible team that I get to work with and makes TOC what it is. So I just want to acknowledge that and start there. And to bring to life the team's work in a mission moment, a patient story was asked of us, and it's really hard to just pick one story and justly share the trauma and journey of such a patient. But know that we have seen and learned so much from so many of our patients in TOC. For example, I want you to imagine a person experiencing homelessness who from living on the street suffers from a car accident with multiple broken bones and has the opportunity to heal and recover in a nursing home with us, then in a respite facility with our department partners, and finally be able to discharge without any need for a cane or a wheelchair. Or I want you to imagine a patient with an amputation from their diabetes who gets the support from our case management teams that includes nurses, CHWs, social workers, to eventually get a prosthesis and feel some normalcy in their life. Or what about the immigrant laborer who gets injured on the job and goes to the hospital suffering from multiple injuries? While in the hospital, he meets with our team, nurses and CHWs again, and is enrolled in MAP thanks to the program we were able to build with our eligibility partners. This then allows him to engage with other resources like primary care with our partners in the community. Or finally, I'd like you to imagine a patient who had to go to the hospital every week on the brink of death for emergent dialysis, and now with dignity, they're able to go to a dialysis center 3 times a week. These are just a few of the real scenarios where we are humbly able to support our community. Sometimes we support our patients in these ways. Sometimes it doesn't always work out. And other times it is meeting them where they are, which can mean a lot of different things. It can mean getting them a phone or just a pair of shoes if that's what they need. And we're more than happy to do it on our team. I know this was more than one mission moment, but I wanted to share a few stories to illustrate the glue, the magic of our team. We are community health workers, providers, social workers, nurses, and so much more, with the support of wonderful operational excellence. Our teams are at their core driven by human kindness and the idea that human connections lead to better outcomes. We are a compassionate ear and the biggest advocates for our patients when they feel the most broken. We focus on providing a fresh start in the face of trauma and leading from kindness, and we are incredibly thankful to shape this work with many of you. Thank you again, and this is my mission moment.
Thank you, appreciate it. Thank you, Dr. Patel. And up next, I will time myself, but I have a mission moment. Okay. Hello, Board of Managers. Good to see everybody here in person. My name is Yesenia Ramos, and this is my mission moment, or all of our mission moments. Today, we have the privilege to showcase the wonderful impact of our neighborhood-focused version of the Community Health Champions program. We're really excited through these stories of 3 graduates that were brave enough to be in our video. This was a fully Spanish-speaking cohort that we graduated just last Thursday. From addressing disparities in healthcare access to promoting preventative measures and fostering a culture of well-being, our community health champions embody the spirit of grassroots activism. Their stories are testaments to the profound impact that can be achieved when communities are empowered with knowledge, resources, and support. They are not just graduates, but they are catalysts for change, ambassadors of hope, and champions of health. And so we have this video we would like to share with you all. It is some parts are in Spanish, so we did add some subtitles. Hopefully they're big enough.
El programa de campeones de salud es muy bueno, es importante para nosotras como promotoras de salud saber sobre los recursos que nosotros estamos ayudando y representando a la comunidad, enseñándoles sobre las ayudas que hay por medio del centro de salud.
Me voy con un aprendizaje tremendo, estoy muy feliz, muy emocionado, porque la primera vez que me involucro en algo así y voy con todo, quiero aprender un poco más también del programa, no solamente con lo que aprendí en esos días, sino que quiero seguir como adentrándome un poco más, conocer un poco más para tener mucha más información, para poder brindar más información y transmitir ese mismo entusiasmo a las personas para que también ellos sean partícipes de esto que la verdad es muy grande, muy grande.
Now that I got help with a lot of resources I can share with my community, I also help my community get application for the MAP program.
A mí me pareció muy interesante este programa y definitivamente tanto a promotoras de salud como cualquier persona que quiera estar informada sobre el Central Health, yo les invitaría y yo voy a ir a mi comunidad a hablar sobre este programa y decirles que es muy bueno.
Right on time. And that was our mission moment. Thank you. Thank you. And up next, we have Kent Casius. Sorry.
evening, everybody. So, talking about Women's History Month, we also wanted to turn the lens internally on our employee community as well. So, again, my name is Ken Kaziski, pronouns he, him, and I'm the Enterprise Manager of Diversity, Equity, Inclusion, supporting the entire enterprise here today. I'm really happy to shed the light on our internal efforts from our DEI Council. And really, before I get into that, I really want to thank Leslie, Veronica, Jackie, Adriana, Carla, Leonore, and Imelda, who y'all met last month, who is part of our team who have been driving some of these efforts the last month or so. Really, we kicked it off earlier this month for International Women's Day on Friday, March 8th. And for that day and for entire Women's History Month, beginning of the month, we were able to highlight words of affirmation and encouragement for women across the enterprise. So we joined the Central Health All Staff meeting, as well as the CUC All Provider meeting, to just provide an opportunity for people to take some words home, highlight some fun graphics, take photos, and just collectively share experiences and highlight powerful women in our workplace. And really make sure that we're pushing those affirmations throughout the entire enterprise. Specifically, if you want to go to the next slide, we also worked on highlighting stories and efforts of women throughout our enterprise. So really honed in on the theme of women who advocate for equity, diversity, and inclusion, which is about embracing and highlighting women who make sure they are removing barriers for all and are really evaluating policies, procedures, and behaviors in our workplace, really promoting women who are creating and developing innovative and inclusive processes and fighting for injustices in our workplace and beyond. But we highlighted this internally to our employees around the theme, some information about our female representation statistics, as well as highlights of our employees and the programs they're doing. And then on the final slide, I want to highlight an example of how we highlighted women across our enterprise. So these are on our internal intranet sites for all of our employees to highlight women in their lives and also themselves about, what are critical projects or missions that they're passionate about. Who is a woman that really inspired you into your career today? What advice do you have for yourself and for your coworkers? And really just to give them a model and to give individuals opportunity to share more about that. And today, if you have a moment, a break, just outside of the wall, outside the board of managers meeting, you'll see some of these profiles. They also are virtually on for all of our employees to see all throughout the month. And then additionally, in other locations throughout the enterprise, we're getting it up for all employees to read and share about the amazing women working at our enterprise. But hopefully y'all can see a little bit of the work that our DEI Council is doing, and we hope to bring many more of these opportunities for you all in the future. So thank you.
Thank you so much. Appreciate it. We would love to also see them in person as well. Does this conclude our? Okay. Thank you. So that concludes our public communication. I would also like to take the moment to honor as well. This month is Ramadan. The holy month of Ramadan is a month of fasting for Muslims all around the world, a month of caring, a month of empathy and compassion, and a month month of forgiveness and prayer that we honor and take it's a special moment in our lives, and that we get to experience it. And it's not just about abstaining from food or water. Do not even drink water. It also teaches us to cleanse our souls and heal our hearts, our wounded hearts these days. I also want to take the moment to honor, in honor of Women's History Month, the Palestinian women. Palestinian women are brave, are powerful, are intelligent, and are resilient. And especially the mothers in Gaza, those who are currently experiencing the darkest moments in their lives, who are forced to bury their children, who are forced to witness their children die from starvation. And to bear the pain of the war. For the past 6 months, over 33, almost 33 Palestinians have been killed, and 70% of those are women and children. And I believe every woman, every person, every child deserves to live in peace, in dignity, and with freedom. And I hope that you all do not forget those who are suffering as we are in this holy month of Ramadan. And thank you for your time. And with that, managers, I move to our committee agenda. Agenda item number 1, approve the minutes of the February 21st, 2024 Budget and Finance Committee meeting. Do I have a motion? Manager Brinson?
I move that the committee approve the minutes of the February 21st, 2024 Budget and Finance Committee meeting.
Thank you. Do I have a second? I have a motion by Manager Brinson and a second by Manager Jones. Any discussion? All in favor? So the motion passes unanimously. Thank you. Agenda item number 2, receive a presentation on the February 2024 financial statements for Central Health. On this item, Nikki Haley and Patty Bithke will be presenting. Thank you.
Hi, I'm Nikki Riley. I'm the Deputy CFO. Jeff is sick, so I'm here in his place, and he's warned me that I'll be taking over shortly, so this is my first crack at this. But I'll let Patty do the majority of the talking.
Right. Good evening, managers. I'm Patty Bethke. I'm the controller for Central Health, and I will present the financial statements for Central Health for the month of February and year to date. Starting with the balance sheet, we want to start with the total unrestricted current assets of $762 million. This is primarily made up of our cash and investments, and Central Health, as you can see, has a strong cash position at $730 million. We also have our total current assets then of $948 million, and our total long-term assets of $361 million. The total capital net of our depreciation is $170 million, and that brings us to our total assets of $1.48 million. In our liabilities, our total current liabilities are $44 million. Currently, our debt service payable is at $11 million. The debt service was paid on March 1st. So that's the whole year's worth there. Total liabilities are at $519 million, with our total net assets of $961 million, giving us total liabilities and net assets of $1,480,000. And then moving on to the sources and uses, you'll see that our total property tax revenue for the year is very strong, as we had expected at this point in the year, of about $310 million. That is 99% of the expected budget. Our total sources are $329 million year to date. And then moving down to the uses of funds, year to date, the healthcare delivery program spend is at $86 million compared to FY23's year to date spend of $54 million. This year, at this time, we've spent 29% of the budget. Our total uses for the year are now at $105 million, giving us excess sources over uses of $224 million. And I'm going to let Nikki discuss the reserve balances.
So in our fiscal year 23 budget, every year we forecast an ending fund balance, and for fiscal year 23, we forecasted an ending fund balance of $407 million. And if you look back in prior presentations of financial statements, you'll see that it said to be determined what that actual amount was, because we were not finished with the audit, but now we are. We do have an audited number, and that audited number is $441 million. It's approximately $30 million more than we had budgeted, and about half of that is due to the unexpected increase in interest rates that we experienced for fiscal year '23. As you recall, we do the budget and prepare 6 months in advance of the actual tax rate and the beginning of the budget. And Travis County's investment team help us with that budget, and they are very conservative when it comes to interest revenue, not just making sure that we actually experience what the budget is. So that was probably about half of that additional 30 million. And then every year we're going to experience delays in projects, unfilled positions, and new positions that we haven't been able to fill yet. And that was about the other half of it. If you recall, RZ was deferred. And so that hasn't been opened up yet, which was a big piece of that, $15 million. If there are any questions about that, I'm happy to answer those.
Any questions, board members? Okay. Good, thank you.
All right, and then moving to the healthcare delivery slide page, you'll see that our total purchased healthcare services year to date are at 43 million. That's 29% of the budgeted amount. And that our direct services, which are continuing to grow on a monthly basis and will continue to increase throughout the year, are at 3 million year to date in that new program. With that, if you have any questions or comments about the financials, we'd be happy to answer them.
Well, thank you so much, and I wish Jeff a speedy and quick and healthy recovery. Best wishes to him. I do not have any questions. I'm going to open it to the floor to any board members. So I do not see any questions. I guess you guys did a wonderful job. Thank you.
Thank you.
Oh, yes.
I'm sorry. I'm sorry. Thank you. Under the healthcare delivery specialty care, there's still a budget for Project Access, and that program has been closed.
This is correct. When we prepared the budget last year, Project Access was still a going concern.
Okay, thank you.
Thank you. Okay, thank you all. Appreciate it. Now moving along to agenda item number 3, receive and discuss the fiscal year 2025 strategic priorities and budget development process and calendar. Monica Crawley and Dr. Pentley will be presenting.
All right, well, thank you for having us for this item. We want to make sure to present this item here for additional conversation consideration. We've covered some of these items in a previous board meeting. This was a slide actually that didn't make it in the packet last time, so we want to make sure it was here. And just to read through briefly, this is the reason why we have embarked upon an adjustment to the timing of the strategic and finance planning cycle. And so the 5 goals are to really support our focus, our ability to lift up and actually promote alignment within our own organization, with the board, with the Travis County Commissioners, with our external stakeholders. So it's clearer what problems we're trying to solve and how we're going to go about doing that. And we have a chance for input from all parties to do so. It also, by measure of that focus and alignment, helps us make sure that we are focused on that healthcare equity plan, which is the work of so many voices in bringing forth the gaps and putting actual programs and services around that over the next 7 years. And so that is the North Star of what we're here to really meet and deliver those promises made. And so we want to make sure that we are focusing on that at the center, so that's important. There's also an element that if we don't do this, then we risk not hearing what some of the key issues and concerns are until much later in the process. And if some of those concerns are vital, then they're going to come up, and they might come up at the last minute. And so we want to try to get ahead of that and have that orderly and aligned conversation earlier. So hopefully there'll be fewer surprises. And then finally, the sense is this is the way that growing organizations, maturing organizations do run their annual cycle. So commensurate with our growth, we want to really continue to improve and stand up, annual cycle that was sort of commensurate with our organizational maturity. So there's some of the goals there. I want to hand over to Monica Crowley to go ahead and walk us through this timeline. Even though the board has seen it before, I'll mention that something like this, I think, benefits from us actually, touching again, so that we are all familiar with what it said here. And the hope is actually that we empower all of us to speak to this, as we are engaging with our constituents and help them describe what we're doing and why, and where the periods are where we absolutely are looking for voice and input and comment, and then where the periods are where we're really now doing the heavy lifting of baking that into programs and budgets and getting that underway. So over to you, Monica.
Thank you so much, Dr. Lee. And like Dr. Lee said, we first introduced this new process and timeline at the Strategic Planning Committee earlier this month. And we hopefully will, like the COG slide, hopefully this process is going to be something that we took the feedback that you gave, we've iterated it into this version, and hopefully it will continue to change. But we were in a meeting with representatives from the county yesterday, and one of the things that they said is, they asked Integral Care if they also had something like the COG slide that was high level, and she said, now when I think about this comprehensive system, I have that image, I think about Central Health. Do you have a grounding slide? And so I hope that this also is something that over the coming months and years can become a grounding slide. So you will probably see this again, and there are likely to be iterations. So thank you for going through this process with us. This is a process both for developing how we develop the strategic budget priorities for the coming year, and also the timeline for the budget development and adoption that flow from those strategic priorities. As Dr. Lee said, if you look at the work under the different parts of the timeline, it really is focused on this trust building, on gathering feedback from the board earlier in the process, both on our approach and on the proposed priorities, like in addition to gathering feedback from the board in March 6th about this process itself and making some changes and clarifying the language in this document based on that feedback. Today, we are also discussing the driving forces, new forces in the ecosystem at the board meeting in a few minutes. We'll get feedback from the board on what forces might drive new emerging priorities. And then also, this gives us an opportunity to both provide you a reminder of, which will come during the April 10th strategic planning meeting, of the healthcare equity plan, what had been proposed as part of the strategic work for, as strategic priorities for fiscal year 2024, reflecting on where we are in that work, looking at kind of where we are looking forward to fiscal year 2025, what had been proposed and potentially budgeted out as initiatives, and then what might need, because of emerging priorities, either to be pushed up or to be pushed off to later years, or things that might require us to work on that we hadn't considered before, which are what Dr. Lee is referring to as the emerging priorities. And so as you look, this is a process that builds on itself, both from the past years and from work that we're continuing today with you as board members that will continue into April. And then if you look, something that's different about May that we wanted to call your attention to is that in May, instead of having an earlier in the month strategic planning committee meeting, because we are going to be taking feedback that you're going to provide to us on some staff proposed emerging priorities in April, that we also may, if it needed, have additional conversation at the April board meeting. We are going to be bringing the kind of staff proposed, both track 1, healthcare equity plan priorities and staff emerging priorities at the May board meeting. And also the May board meeting is an area where we're requesting this to be a deadline for board-sponsored recommended emerging priorities. One of the things that we're doing on the staff side is, even though work had been proposed and approved as initiatives in the healthcare equity plan, and we're gathering feedback from the board on emerging priorities, all of that work goes through a business case vetting process. It goes through a process on the internal staff side of where compliance, finance, human resources, joint technology, all of the operating and strategy and communications and external affairs and legal vet the feasibility of those proposals. And one of the things, by coming to the board early, discussing the driving forces, discussing the emerging priorities, and asking for board proposals to come by this May 22nd meeting, is that we will then be able to take all of those proposals and run them through that same business case type of feasibility and vetting process. And this really gets to this trust and transparency that Dr. Lee was discussing. And then hopefully by the time we get into June, we will have gone through that vetting process. We can finalize and all agree on what is going into the budget. And then this budget development process and vetting with the community and public involvement can really begin in earnest. And if you look, the descriptions in July, August, and September are shorter, because that's when we've gotten past the strategic planning part and are really into looking at the proposed budget, the budget resolution drafts, and then moving towards budget approval in August and September.
So thank you, Monica. And then just to take that up at the highest level, right? There's a few steps here. March, what are the opportunities and threats out there in the ecosystem that we should respond to in the next year? April, how does that become key priorities? Problems that we're going to try and solve, things that we want to accomplish. May, what are the ways that we could go about solving those problems? Prioritize amongst those. June, more baked actual business processes that we've run through this process and we've now built out some flesh around that. Do these look good? July, prepare those into an actual budget proposal. August, review and approve here. And September, hopefully, review and approve at the County Commissioners Court. So you can sort of see these high level, and of course, every plan evolves differently in practice, so we'll learn as we go. But this is the idea, to have sort of an orderly progression from what's out there to what are we going to do, how are we going to do it, and everyone's part of that conversation in this orderly build. So just wanted to kind of provide that high level, and we would love to hear your thoughts and advice, guidance, and questions.
Thank you, appreciate that. I think this is much needed. Definitely, I think this will be helpful for board members as well, to identify a process. But I would hope that we have a workflow, like a chart, like who to contact, the process, and for transparency, what does your business case look like? What do you look for? I think this flow chart should be applicable to us as board members and to our elected officials if they foresee an issue or not. I think that would be very helpful. We want to be very transparent, and also we want the issues to be transparent to us. So we would like to at least get a summary of what was submitted and considered, because I do not want to dismiss an issue without, there may be substance to it. I think it would be we should know what are the issues, and maybe something that you may have failed your business case, but we may perceive it as something that we should really invest in. Again, we want something to be based on definitely evidence-based, the data to support it, and alongside our mission and our priorities. So with that, I'm going to open the floor for any board members to chime in. I will start with Dr. Moran.
Thank you, and thank you very much. I guess I'd like to clarify that after board sponsor recommendations and or staff sponsor recommendations, that essentially an opinion be delivered by staff about the economic viability in a very concise manner so we can assess it. And not, once again, arguing for transparency on the issues, and not, as I think we all agree, not even last minute issues come up. So an opinion from staff would be very valued. Thank you.
Absolutely, and actually, and I absolutely love the idea of putting together a one-page that describes either the workflow or process, something that's understandable for the entire board coming through. And so that's something that we can bring back to the board soon. I think it is anticipated by the process that at this May 22nd meeting, that that would be a place where anything that has been proposed by the board or external partners through the board as an emerging priority would be laid out on the table for board feedback at that meeting. And then staff would work with people, and we can let people know what's in the business case kind of form and what's considered, but staff would work with folks on those business cases. And then I think it's anticipated by this timeline that in June, at that June 5th Strategic Planning Committee, that those kind of summaries of the results of that business case process would come back to the board with recommendations to the board at that June 5th Strategic Planning meeting.
Thank you for that. If possible, that we can have the workflow soon. So I think to give people ample time. And I'm sorry, another thing I missed to mention, I think we talked about it during our meetings, is there work groups with the commissioner. I wonder when those are scheduled. I would rather have those as soon as early in the process rather than later. I think it will be helpful for all of us. So I'm just, if you can provide us with some coordination and dates for that as well.
Sure. So let me just first echo both what you mentioned, Chair Masaitif and Dr. Merton. That's exactly the goal we're aiming toward, to be able to clearly see how this is supposed to work, and then to be able to have a clear inventory of all the ideas that came forward, how they were assessed, if they moved forward in the business case development process or they didn't, why, right? And to be able to make some of that easy to digest and transparent. I will share on behalf of the staff, this is one of those cases where we're building the plan while we're flying it, and so a little bit of grace since we are actually shifting this process in flight. So it's not going to be perfect, but we will certainly want to make that transparent and know that we are going to improve and evolve. And then your second question about the work sessions with the county, absolutely. Perla, correct me if I have this wrong, but I believe the first one is scheduled in May, coming up.
May 9th.
May 9th. And then I believe...
We're working on pinning down a date for June and July. And then the fourth session would be in September, which would be when the commissioners would vote on our budget.
Perfect. Thank you for that.
Thank you.
Any further questions?
Yeah. Did you have any?
Chair Kitchen.
Yes, and thank you for this. I think this is very helpful. And so just to reiterate what everyone has said, then it would be helpful on the website to have a place, I think you may already, but the place on the website that speaks to the budget process, include this timeline, include the one-pager that I believe that you referenced that is, that tells you the steps. So for example, if there's a board member or a group that wants to suggest something, what do they do exactly? Step one, they fill out XYZ form, here's where you get it. Step two, here's the criteria on it. Just something very specific so that people know exactly what they need to do. So that would be helpful. I'm sure y'all have already thought about that, but I know it's a work in progress, so that would be very helpful. I think it would be helpful also to put those work sessions on the website, so that people know when those are.
Timeline.
Yeah. Or on the timeline. Yeah, put those work sessions, you're right. Put those work sessions on this timeline. Now, I know that you don't know exactly where they all are, but when they all are, but put them in whatever month you think they're going to happen, so that we have acknowledged that, and that we know that, and then of course you'll be letting the board know when those are, so the board can participate if they'd like to. Right? Okay, thank you. That's it.
Manager Jones?
Well, thanks very much. It's very, very helpful. I guess my question is, and goes back to the enterprise. Is there an opportunity for the enterprise board members to come together either during or right before that, so that there is a synergy of thought in terms of what we're doing, what they're doing, so that when we go forth to the Commissioner's Court and to other places, they see that synergy in terms of planning? Are there some built into this some synergistic things that they're doing that we will be doing likewise, or timelines to do that? So I would just encourage us to see, if possible, and I agree with you, Dr. Lee, that we need to make sure that this is a first go-around and it'll be new. But as we go forth, I think that's a good opportunity to incorporate them in this process.
So Manager Jones, who are you considering from the enterprise? Is it community care, Sendero? I'm just trying for clarification.
Our enterprise partners, because I think that even though they may or may not have different sources of resources too, they're all under the same rubric of what we're trying to achieve. And goes back to the question I've been raising, is that we're all the same entity, and until we start acting that way, we're going to have these fractured types of presentations, or I should say fractured, but lack of consistent synergy in that. So that's what I'm trying to get at.
Thank you.
Is it okay if I speak a bit to that question? So I absolutely agree with you, Manager Jones. You've heard my remarks around trust, around one trunk, many branches, around one family, one mission. Absolutely. The more we do that, the more able we are as a family, as a system, to really move our mission forward, right? And be seen as the most credible and responsive and capable partners to all of our agency and elected official partners in this area. And so, absolutely. Some of the steps that we're taking toward that, the three CEOs are meeting regularly. We are, at senior staff level, we are beginning to absolutely collaborate and coordinate. The board will be seeing us putting forward, I believe the target is May, actually two specific examples where we are going to line up a strategic priority for both organizations, and want to share some of that. That work is ongoing as we build that out. We're going to bring it here, and likely we'll do the same across the enterprise, at least connecting up through senior staff. So we're working our way into a place where we are directly aligning around the work, around the core priorities, and increasingly looking like and feeling like one family, one mission. That's a work in progress, but I can speak on behalf, I believe, of Jason Forney and Sharon Elvis, that the three of us absolutely share that vision and are taking active steps toward it.
Yes.
And that's great. I just want to make sure we talked about a board retreat, so that all board members.
That's on the agenda.
Okay, so that all board members are on the same page as well, or start getting to the same page.
Yeah, thank you for mentioning that. It's coming up.
Thank you. Manager Motwani, do you have anything?
Very helpful. Echoes, I think, continuous improvement, echoes rapid cycle evaluation, and the fact that this is an elastic and breathing document. Really glad that not only board members will have a chance, as well as community members and enterprise partners, to be able to incorporate emerging priorities, but also that an incoming chief executive will be able to do that too. So I appreciate the process, as well as everyone's suggestions. Thank
Thank you.
No reply needed.
Thank you. Well, I believe those are all the comments we have. I appreciate you, and it's an ongoing work, and we adapt it. Nothing is perfect, and that's what it is, about implementing these projects. It's a continuous improvement. Thank you. Appreciate the efforts. Now, there are no motion necessary for this item. We will be moving to item number 4, receive updates on Central Health capital projects and take appropriate action to increase the budget for the Hornsby Bend capital project. Nikki Haley and Stephanie McDonald will be presenting.
Chair, Ms. Saitov, is the name Nikki Riley?
Yes.
Oh, sorry.
What did I say? Sorry, watching too much politics.
You want Nikki Riley up with me because Nikki is an actual accountant.
Please forgive me. I'm functioning without caffeine here.
It's okay. She's going to just keep me honest on my English major math. If we could go to the first slide, please. So we'd like to give you an update. I think this is something that you have requested, Chair Saitov, and we will continue to bring this up with the financial reports in the future. This is our first stab at this, and I want y'all to know that it is iterative. We have included essentially what the original project budget is, and I do want you to know that those numbers do change, and I will like to put a little placeholder out there for some future updates specific to Hancock, given that we are now finishing out the entire building. We are also going to come back around Colony Park. That budget was adopted a while ago, and we have some fresh numbers, and I think you will see kind of how we are using our current projects to kind of predict and forecast where we are going to end up with the future projects. It is as you know, a very volatile time still. I was listening to some reports about the bridge, the incident in Baltimore with the bridge and how that's really going to impact supply chain. Luckily, it's not automobiles, but that we are going to be impacted, but likely construction machinery that comes in through those ports, that port that, we don't know how that might impact some of our plans, but we will, like I said, come back to you, I think, later on both Hancock and Colony Park with some revised numbers, but I think this is tracking. And Nikki, anything else that you might want to add? Because your team and my team have worked together to make sure that we are kind of doing what we, the budget to actuals, yep.
We have been working diligently together, and I feel very comfortable with Manning's, the way he forecasts out. And finance is also trying to help them get better reporting on looking at their budget to actuals. I think it all became a lot really fast. And so we're kind of trying to catch up on the reporting that we need. But I feel very comfortable with this. We do have some debt proceeds left on some of these projects with Hornsby Bend, where I think we're almost out of debt financing, and so we'll be going into the reserves that we have, and we'll be cash funding that in the future.
Happy to answer any questions, and my gratitude to Nikki for really having been able to work with her team. We are going to start getting better cost reports.
Thank you, and we have an action.
Well, no, there's one more slide. Next slide. So, okay. So we know that we have 2 more pay applications that are needed before we can close out the Hornsby Bend project. I think you see that $509,829 number in the construction line. We know that those are still out there. And because of that, plus some other additional places where we have incurred additional costs than what we had budgeted, we are going to ask you all tonight to recommend that the Central Health Board of Managers increase the project budget by $900,000. We believe right now that that 855 number is pretty accurate. It's 856 if I round up, right? It's pretty accurate. We don't expect there to be additional costs beyond that, but we would like to have you go ahead and increase the project budget by 900,000. Next slide, please. So here's what happened. The primary cost drivers were professional services that we just did not anticipate up front. A lot of this is related to engineering to put in the utilities. My husband reminds me it's the law of shooty fath. Whoever gets out there first has to put in the utilities to support everybody else. And so we put in 19 power poles to get power to this portion of the Hornsby Bend community. Even though there was power across the street, I think we have now just benefited Elon Musk, who's next door, but we did get there first. And the other things that happened, we did not anticipate. There was a sinkhole that developed. When that sinkhole was excavated, we did discover bones that you all remember. I think some of you in some of other meetings and other settings, they were animal bones, but we did have to go through a process. It involved an archaeologist and working with the state of Texas and the medical examiner's office, actually. So that was something that was unanticipated, that did have some significant costs associated with it. The playground change, remember we made an adjustment and went with an all-inclusive playground. It's been a really tremendous asset. We love having those kids and families out there, in addition to having the adult fitness equipment. That was an extremely significant change in the several $100,000 and what we had budgeted originally. And then I think just overall, we have learned that the supply chain issues, the labor issues that are facing this sector primarily around construction impacted the project. And I think that is how we ended up being 855,000 over what was originally anticipated. And I'm happy to answer any questions.
Thank you. Can I have a motion?
Next slide, please. This is our ask.
Yes.
Okay. I move that the committee recommend that the Board of Managers increase the Hornsby Bend Health and Wellness Center project budget by 900,000.
Thank you. I'll start. Where's this money going to come from?
So cash primarily. We have some debt proceeds left for Hornsby Bend, and then the rest of it would be cash financed from our reserves.
Okay. Thank you. Manager Jones? Oh, sorry. So we have a motion on the table by Chair Kitchen and a second by Manager Jones. Thank you. Any discussion? I see none. All in favor?
Aye.
So the motion moves unanimously. Thank you. Now,
I'm going to stay in the hot seat if that's okay.
thank you. Yes, please. We need you here. Agenda item number 5, discuss and take appropriate action directing the President and CEO to negotiate and execute an agreement with the Texas Department of Transportation for transfer of real property impacted by the I-35 expansion project. Stephanie McDonald will be presenting. At this moment, I announce that the committee is convening in closed session to discuss agenda item 5 under Texas Government Code 551.071, consultation with attorney, and or Texas Government Code 551.072, deliberation regarding real property. So it is right now March 27th, and it's 5:12 p.m.
Super encrypted file, yes. Thank you.
Thank you. We are back from closed session, and it is March 27th, and it's 5:23 p.m. Do I have a motion, Chair Kitchen?
I move that the committee recommend that the Board of Managers approve the settlement with TxDOT for the sale of the David Powell Clinic at 4614 North IH 35 frontage road, subject to the delayed move-out date discussed in closed session, and direct staff to seek needed approval from the Travis County Commissioners Court.
Thank you. Do I have a second?
I second.
So we have a motion by Manager Kitchen and a second by Manager Brinson. Any discussion?
Call for the question.
Sorry?
I call for the question.
That means you can call after the vote.
I think we can go ahead and
Just
vote.
Okay, thank you for that. So all in favor?
Aye.
Manager Motwani? Manager Zamora?
I just got here, sorry.
So, are you abstaining? Okay. So can you please make Manager Zamora abstain? So the motion passes. Thank you, members. Now moving on to agenda item number 6, confirm the next Budget and Finance Committee meeting date, time, and location. Managers, our next Central Health Budget and Finance Committee is tentatively scheduled for Wednesday, April 24th, 2024 at 4 p.m. at the Central Health Headquarters, 1111 East Cesar Chavez, Austin, Texas, 78702. At this time, I'm ready to accept a motion for adjournment.
So moved.
Okay, meeting is adjourned.
Okay. Okay, everybody. So let's see. Good afternoon. Today is March 27th, and it is 5:24. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Executive Committee, and we'll now proceed to the Executive Committee agenda. Now, let me also just let everyone know that due to schedules, we are going to finish by 6:30 today. We have 2 major items to talk about between the Executive Committee and the board meeting. So I'll be moving faster through the other items to give us time to really talk about the 2 things that we need to talk about. And the 2 things we need to talk about, just as sort of, is our public input process and our emerging priorities. So that's where I'm going to emphasize our time. So, okay, so we're back to the Executive Committee agenda. First item for business is to approve the minutes of the Central Health Executive Committee. I need a motion. Okay. Okay. Okay, second from Manager Brinson. All in favor? Aye. Okay. Item 1 passes. Moving on to item number 2. Review and provide direction to staff on the prioritization and tentative scheduling of items for consideration at future Central Health Board and committee meetings. This item is in your backup, so we will not be presenting. There is one part of that item that I'd like to go around the room and ask people what they think. This particular item is the item that lays out our schedule, for our upcoming committee meetings and board meetings. So one of the items on that I'd like to get people's feedback on is the retreat. And so what I'd like to do in the interest of time is go around the room and give everyone just a few minutes to tell us what they would like to get out of a retreat. Now, understand that this is not your last chance. So just tell us what you're thinking today so we can provide some guidance for staff. And then staff will also email to you all, and you'll have opportunities to say more. So I'm going to start on this side of the room with Manager Martin. Or do you want me to start on the other side?
That's fine.
Okay.
I mean, I'm taking a macro view of things anyway.
Yeah.
I would hope that in our retreat that we could come to a consensus, or at least a respectful view of where we wish Central Hope to be 15 years from now.
Okay.
A vision and how we might institute that.
Okay. All right. And let me just say that I know staff's keeping notes of what everybody's saying, and so we'll be able to feed that back for folks. Okay. Manager?
In addition to a timeline, or the development of a timeline of priorities as to how we're going to get to this vision, which is what I'm sure each and every one of us is going to talk about, I'd also like to know how staff prioritizes what we do, what it is we do for prioritization that they bring to us, such as, the implementation of initiatives on the health equity plan, how it is that we decide where we're going to spend our advertising and marketing dollars, and things like the evaluation of the contracts that we have in place, and how would we use better policies to make sure that our goals are achieved and outcomes are achieved as we head into that initiative implementation. Thank you.
Okay.
Sort of along those same lines, I think it would be helpful to know what the predictions are for the city of Austin and the growth that's going to occur in these next 15 years, so we can kind of see what we're going to need. And that would include potentially numbers of population coming in and potential hopefully rise in our income yearly. And then I also would like a just brief some knowledge about how they do it in Houston and how they do it in Dallas, so that we can sort of be thinking of our own ways.
Okay.
Thank you. Well, I concur with everything my board members said. I would also encourage us to think about ways, how do we enhance our collaborations with our partners, and how, so I think that's critical. And the second part, some type of team building, I think it's necessary for all of us. And lastly, I hope that this retreat is not heavily dense, so we can really tackle the issue, because sometimes agendas can be very long and dense, that we would not give it its full attention. So I encourage us to really have some really meaningful items that we can really dive into it deeper and not peripheral. So that's it. Thank you.
Thank you, Chair. I agree with Manager Musaitif. I think we don't want to overdo the retreat. We don't want to burden it with too much on there, but we do want to make sure when we see what's going to happen in the next 15 years. I agree with Manager Martin and Manager Brinson, because we need to know. We need to know where our dollars are going to come from, and who we need to serve. And you've heard me say this many times. It's about the patients. It's making sure the patients get what they need in the next 15, 20 years.
Manager Jones?
I agree with what most everyone said. I do think we need to spend time talking about, in terms of the 15 years, where we as an enterprise, what that will look like. We have a healthcare district unlike any other major one in Texas, and I think we as a board need to understand, where do we believe it should look like? Should we be more incorporated, or should we continue along those lines? And I agree with what Manager Masaitis said also. I don't think we need to spend a lot of time on some of the minutia, not that any of it's minutia, but we need to spend some more time on these big picture issues as opposed to on some of the other ones. But saving time later on to go to the other ones.
Okay. Manager Motwani?
Agreed on I'll just begin by saying I think that it would be great for each of us to be able to share individually what our priorities are and our motivating mechanisms are for participating on this board, either our own individual priorities as well as those for whom we feel we are conduit for, in as much as our respective neighborhoods and communities in the county at large. I think that lends itself to team building and chemistry building. But getting a sense of what those priorities are with relation to the health equity plan, and what Dr. Brinson mentioned about best practice sharing from peer organizations, I think would be uniquely helpful too. Thanks.
Thank you all. I agree with what everyone has said, and would just emphasize that it'll be great to use the this retreat time to really talk about our visions, both our visions, our vision for the organization, as well as what we all bring to it individually. So it gives us a chance to learn more about each other, as well as to focus on where we want to be in the future, so that we're all marching in the same direction with the same messaging. So, okay, thank you all. This was great. I'll ask our staff to keep all of these things in mind, come up with a draft, and then get some more feedback from the board once you've come up with the draft, so the board will have another chance to give some feedback on what the actual agenda is. Okay, we're going to go on to the next agenda item, which is agenda item number 3. Discuss recommendations to increase access to Central Health public meetings. So we have Mike McKinnon, Yvonne Davila, and Ted Burton presenting. And I'd like to finish this item by 6 o'clock. So if y'all can take whatever you think the appropriate amount of time is and give us some time to give you some feedback. Okay? Sound good? Yeah, okay.
Yeah. Hi, everybody. Ted Burton, Chief Communications Officer.
Yvonne Davila, Senior Director of Marketing and Communications.
And Mike McKinnon, our Senior Communications Manager. He's doing double duty. He's producing the meeting, and he's also going to help us present. Today, we're going to talk about 3 main objectives. How to increase awareness of Central Health Board meetings. How can we increase accessibility and participation at our Board of Manager meetings? And how can we help better connect you with the community? So we'll talk a little bit about our current state and then some ideas moving forward. Next slide.
So before every board meeting, we share information with the community, information about upcoming board meetings. The information that we share includes meeting dates, times, locations, and links to view the meetings online. We also include the various ways in which people can sign up to speak during public communication. For example, they can call a number and leave a voicemail message. They can sign up online, or they can come in person and sign up in person. These community updates are shared with partners across the county, as well as community advocates, elected officials and their staff, and members of the media. These updates are shared via email, as well as in person at community meetings or neighborhood association meetings. Board meetings are also promoted on the Central Health website and social media with links on how to access our YouTube channel. We send media advisories with news outlets so that they can come over to cover the board meetings, or they can add it to their community calendar as well. That's before any meeting takes place. And then during board meetings, we share information regarding key action items. We call them breaking news that the board takes. For example, passing the budget. That's an important action item. We share this information via email and on social media platforms. We also follow up on these action items after board meetings. Next slide, please. In terms of some changes that we've made to the website, we are continuously improving our website, as you all know. One key change includes the addition of our calendar of events on the front page of our website, like the slide shows. We also post a recording of every meeting with the associated agenda and the board packet on our website. I'll turn this over now to Mike McKinnon.
Okay. Ismail, you're good? Okay. Got to fill in over there for a second. All right, so I will, next slide, please. Keep this pretty brief. Currently, we stream our board meetings to our YouTube channel. This includes all board meetings, so not just the Board of Managers, but all the committee and subcommittee meetings as well. All of the meetings are, like Yvonne said, are posted on our website, including the agendas and the packets ahead of time. So when you receive those, they go up on the website as well. We also include in every meeting posting the link to sign up for public communication. The reason we do this, and the rationale is pretty clear to us, is internet access in Travis County is approaching 100%. It's about 96% across the board. And we do have some data that I think we've shared previously that even breaks that down demographically. And YouTube is a great tool for us because A, it's free to anyone who has the internet, and it's basically platform agnostic. Doesn't matter what kind of device you're using, you can get to YouTube. We are also able to share those links. So during the meeting, we're very easily able to post the link to the meeting. After the meeting, we're able to share the link to the recording of the meeting, but even to specific agenda items. So if we want to share a particular discussion with a specific group, we can email that link out. We can post it in social media. We can just say, here's a bit.ly link. You can go right to that discussion. So it's very easy and very convenient, but also incredibly accessible for most people. If you could go to the next slide, please. So the question has come up, how do we broadcast our meetings on Travis County TV? And if you're not aware, Travis County TV is one of our local PEG channels, public education government channels. The city of Austin is the franchise administrator for cable operations in the city of Austin, so they are effectively the PEG channel manager. Travis County has a public access channel. We had an agreement with them in the past. They would broadcast our Board of Managers meetings. We actually used to have our meetings in the Travis County Commissioners Court facility before they got the new courtroom. There are some obstacles to getting our meetings broadcast on TCTV.
It's doable, but
It is doable, but there are some obstacles. We would have to have a fixed start time for the meeting. And I realize we have a 4 o'clock start time for our Board of Managers meetings, but there are two small issues. One, Travis County replays the Travis County Commissioners Court meeting held on Tuesday on Wednesday. They don't know necessarily when that's going to end. It could be 1 o'clock, it could be 2 o'clock, it could be 5 o'clock. I have assurances that they don't typically run longer than that, but we need enough buffer between their meeting and our meeting to ensure that we have time to test the system, make sure that there aren't any problems, just to have a gap between the meetings so that they aren't walking on top of one another, because Travis County Broadcast will always take priority over us. It's their channel, it's their programming, they're doing us essentially a favor. The other part of that is because their system is somewhat automated, they would need a start time programmed into the system to say this is when Central Health's meeting is to start, when they would switch that broadcast feed from their programming to our programming. And as you know, because of the Board of Managers meeting, it might start at 5 o'clock, it might start at 6:15, because it's preceded by other meetings. And so we would need to separate that meeting from the other meetings, and essentially we're saying that the Board of Managers meeting will start at 5:30. So if there are preceding meetings, they would have to go into recess. We would start the Board of Managers meeting. It would conclude, then we would rejoin the previously recessed meeting. That would give all of us the ability to program that into the schedule, have a fixed time so we can tell our audience when to tune in, 5:30. It's really the only way we would be able to accommodate both schedules and be able to promote it. Travis County would also replay our meetings. They did this previously. I believe it was on Friday evenings in the past. It would also only be the Board of Managers meetings. They will not commit to broadcasting all of our committees and subcommittee meetings. That's maybe something we can negotiate, but effectively it would only be the Board of Managers meeting. And then another issue is just access to TCTV. This is not an over-the-air channel. You have to be a cable subscriber to be able to receive Travis County TV or any of the public access channels. Those subscribers are Spectrum and Astound. Astound used to be Grande Communication. There are a few grandfathered AT&T U-verse subscribers who are folded into the DirecTV acquisition, but that's a requirement. That's the only way to get TCTV. You can also view it on their website and on YouTube. And it's also only guaranteed to City of Austin residents, and that's just an FCC guideline. They can provide it to Travis County residents outside of the city limits, but the cable providers are not obligated to do that. And then finally, our meetings are English only. We would not have the ability, Travis County cannot facilitate having a secondary audio program where we would have a live translator so a viewer could switch between audio feeds to have English or Spanish. It would have to be English only. So next slide. I've showed you this data before. I really won't spend a whole lot of time on it. This really just demonstrates, this is the most recent Nielsen data we have from last fall, just the saturation of internet access, cable subscriberships, and then also viewership of YouTube. And it's, as you can see, it's broken down 200% FPL, English speaking and Spanish speaking. So I would invite you to look at that if you have a chance. Next slide. Okay. Yvonne, were you going to take this one?
I can. In terms of language in terms of language accessibility, we currently offer Spanish language interpretation for both in person and virtually. And as you know, YouTube can also has the capability of turning on captions in different languages. So that is available on YouTube. And just as a rationale for why Spanish is our base, Spanish and English is our baseline at the moment. It is due to our demographics. In areas of high and moderate levels of poverty, English and Spanish are the primary languages based on our most current data per the 2022 demographic report. And as our language access capabilities increase, we can increase access to board meetings in person and virtually in languages other than Spanish and English.
Okay. Next slide, please.
And then in terms of connecting to the community or doing a better job of connecting board members to our community. So community engagement happens year-round, even beyond these board meetings. These tactics include what you see on the screen: community health champions, community conversations, listening sessions in which our staff attends community or neighborhood association meetings, not only to share information about Central Health and the board, but also to listen to the feedback from the community. We also conduct intercept interviews and surveys, administer surveys at health and wellness centers. Last year, a total of 1,000 people, more than 1,000 people participated in our engagement process. And as a reminder, we presented the community engagement report to the board in September, leading up to the board's approval of the 2020-24 budget. Next slide, please.
Okay, so just some opportunities for enhanced community connection between the board and Travis County residents. We would, when things that we're doing and things that we would like to increase. So as you know, it happened today. We are inviting members and advocates from the community to speak, whether it's Black History Month, Women's History Month, but creating these mission moments. So the mission moments are not just staff members sharing their stories, but we want to hear from community members so we can hear about what's happening out there and connect you with those organizations. We would ask you, and we can help you amplify, if you are on social media, amplify our work on your own social media platforms. In the past, we've done social media trainings, and we're happy to do that again. Some of you are very seasoned with this, and others may not be comfortable. But then also with your own community network. So we would ask you, what format would you like? How could we help you send information out to your own network of influencers? Is it email? Do you want PDFs? What is it that we can help you with, and what type of collateral would you like to help communicate those messages? We would invite you, and many of you already do this, but to attend our community events. So we have, for example, we have in May and July already planned 2 community conversations. Our 20th anniversary community celebration will be this summer. More to come on that. That's a shameless tease. And then just any clinic grand openings. And again, many of you are already there, but how can we help make a space for you, make a place for you? David had mentioned perhaps posting all of these events as official board meetings so that we don't have any quorum issues. Next slide, please. So some recommendations. One of the questions that was raised in a conversation we've had is regarding taking board meetings on the road. At this time, that is not a staff recommendation for several reasons. Technology is a challenge. You've seen sometimes even in this room, which is a set and planned space, we have challenges. We are concerned that taking a board meeting on the road without sufficient staff resources and technology resources, that would be a challenge. There is also, and David could speak to this, an Open Meetings Act challenge. You would need to be in person. It would not allow for virtual attendance and participation. David? Did I get that right?
Yes.
Okay. And then also just finding suitable venues that can provide the technology and broadcast intensive board meetings. During the pandemic, we took the meeting to AISD headquarters, and that was really easy because they have a studio. When we move our headquarters to Hancock, we will have a studio. But until then, finding those locations can be a challenge. It's not impossible, but at this time, we don't feel as a staff that we're prepared to do that. Another recommendation is just to invite you to take advantage of all of the existing community engagement events that I just mentioned. The format of our community conversations specifically are meant to be create two-way dialogue and conversation. And so it's a really meaningful and authentic way to meet our community where they are. Some of you have participated, and we would love to have you at all of those meetings if possible, and let us know how we can help you make that happen. We know you have very busy schedules. As you know, community conversations are sometimes hosted during the day and sometimes during the evening. That's intentional, so we can give people as many opportunities as possible to participate. Can you slide back so I can see? And then as Mike mentioned earlier, broadcasting on Travis County TV is absolutely doable. You will just need to make some changes to make that happen. Thank you so much. I could look that way, but anyhow. But one recommendation that we would like to make as a staff is perhaps you consider starting the board meeting at 5:30 so that we can more clearly communicate effectively to residents when the board meeting is going to start, when public communication is going to happen, and of course, if there's a decision to move forward with broadcasting on Travis County TV, that will be a must. And then I know Manager Musaitis, if this came up, and we could still have a separate public communications for budget and finance or for any committees, but it'd be nice for us to be able to tell the community the official Board of Managers public communication is at this time. And with that, I think that's all of our presentation, and we're happy to take your questions.
Okay, thank you all very much. We really appreciate you putting this together and putting together some recommendations for us. So folks, we have about 12 minutes. So let's get people's reactions. So Manager Musaitis?
Thank you, I really appreciate that. I also have noticed some activity, increased activity, so that's great. Kudos to you, appreciate that. Now, one of the barriers to our patients have always been transportation. And what I'm thinking, maybe something that you can discuss it internally and see how if the feasibility of it. If a committee member elects to come in person, if we can provide cover their transportation cost. So if we can consider that option, because there might be.
You mean a community member or?
Yes, let's say a
Okay.
community member who's, oh, sorry if I didn't make that clear.
Yeah, sorry.
If there's an elderly community member who is a patient of ours, who will elect to come in person to make testimony, I would hope that we can cover their transportation costs, because that's an identified barrier to many of our patients. So I'm primarily focused on our MAP patients. Maybe that's much easier. So again, I understand internet is accessible but may not be accessible to all. Maybe people feel more comfortable speaking in person. Just want to give them that opportunity. So maybe something that you can present to us and see the feasibility of it. So in cognizant of time, I want to allow other members to discuss.
Who else? Anybody else? Manager Jones?
Thanks very much. This is very helpful. Just a question. On one hand, we say we have 99% internet accessibility in Travis County, I think is what you said. And yet we don't have the ability as governmental agencies to go out into communities and broadcast. It seems like there seems to be somewhat of a dichotomy. The technology is not there, the ability to do what we need to do. I just think we need to, not just us, but others to be able to do that. My suggestion was that we do 4 community meetings, 1 in each precinct of the county, at the cities in those communities. So Austin, I'm just pulling out some, Manor, Jonestown, and maybe Lago Vista, well, whatever south of the river there. Briarcliff, I think, is a community. And see if we can work with those communities to be able to do that. those meetings. And I understand the time frame, and that's something we would have to work ourselves. Do we have to do it on Wednesday? Could we do it on Tuesday? I'm just saying, look at other options we might be able to do, because that's how we build consensus for communities beyond what you're doing. You're doing great work. I'm not criticizing it. I'm just saying that, I just think in this age of technology and accessibility, people expect us to be able to respond to them likewise, as opposed to having everyone to come into one place once a month.
Right, and thank you, Manager Jones. And so, as we did for budget season, we did take the budget community conversations on the road, and thank you for attending, I think, almost all of those. We broadcast those via Facebook Live. I could broadcast this meeting right now via Facebook Live, but the challenge would be having everybody mic'd properly. I mean, I think a board meeting is a different level for us from a technology standpoint than a meeting, but we have and we do take meetings on the road and broadcast those via Facebook Live. I was specifically talking to taking a board meeting on the road and having, I believe that there would be an expectation for a certain level of professionalism and having everybody mic'd and properly lighted, et cetera. That would be the challenge. But we do, and we will continue to take community conversations on the road. And it was actually following your advice, I believe, last year, where we did try to take those budget meetings to different parts of the community. And I 100% agree that we should look at opportunities to take them to each precinct.
Okay, Manager Montwani.
Appreciate, of course, everyone's comments as well as the presentation. The key thought that I have is that I would almost prefer that we be looking at goals, the board-guided goals, as opposed to the how. Meaning that if we're looking for community engagement or a higher degree of it, what are we looking for? Are we looking for more engagement of, we want to see more members at public communication. We want to see more people in the seats at our board meetings. What are the metrics? What are the measures of community engagement we want to see? Do we want, more, say, remote engagement or on the roadshow type engagement? And what are the numbers that we're looking at there? And then come back to staff and ask for the how around those things. I think when we get involved in the how, we may lose sight of a lot of the logistical challenges. To be fair, I think all of the suggestions are great ideas. But then, of course, producing a board meeting on the road is extremely challenging, not to mention just producing the ones we have in general. But if we're looking for certain goals, I think we should work backward from what those goals are, as opposed to sort of a nebulous notion, in my opinion, of how do we do, just overall being more accessible and more engaged. And I think a lot of this also starts with asking the folks who do come and communicate and who do come to public communication. We may want to ask them what their barriers are that they experienced, or what would have made their process easier, from the design standpoint. Thank you so much.
Okay. Manager Valadez.
One of the things that I'm very interested in is decreasing the number of uninsured in Travis County. To me, that's one of our reasons for existence, and yet we have never developed a protocol or a policy or a formula for being able to see whether or not we're successful in measuring see whether we could measure that success and whether we have increased or decreased rather the number of uninsured in Travis County. That is our priority. Also getting more people on MAP. We have not, in my opinion, ever received a definite number as to whether, percentage protocol or process for determining what that is. And that, to me, should be our priority. Decreasing the uninsured, because that is our reason for existence. Increasing more people for MAP on the MAP program or MAP basic program, because that is our reason for existence. And tying those successes, measuring those successes and tying them to strategies that we can incorporate into outreach and bringing people to the table, especially people that we've not heard from. I go to all the meetings, I see all the same people. It's the same people. Many of them are contractors. Many of them are employees of our partner organizations. And what I'm always interested in is seeing, okay, who's not one of these? who are the new people that we're bringing to the table? Who are the new people that are coming and speaking before us? And that's very rare. Those people are few and far between. So I'd like for us to be able to look at those kinds of things for measuring success. And other than that, I agree that it's going to be difficult to accommodate taking this show on the road, but that is something that we really should be able to achieve at some point in time. We have the budget to be able to do that. If there's different equipment that we need to incorporate in the development of doing this before we ever get to Hancock, if it's going to be on the short term, is there equipment we can rent, or get a sponsor from, maybe one of the stations. Thank you.
Okay. Anybody else? So I would just add this.
Chair, if I may answer Manager Musaitiv's question around transportation,
okay.
because I don't
Yes,
believe
please
we
do.
have addressed it. We do offer transportation to MAP and MAP Basic members in a collaboration with our Healthcare Delivery Operations Department. We have been offering transportation to MAP and MAP Basic members to any one of our focus groups or our engagement activities. An example is our Accelerated Health Champions program that Yesenia shared with you all during Public Communication and Mission Moment. All those folks are part of our patient population, including Medicaid, Medicare, or not Medicare, Medicaid, and MAP and MAP Basic, and we make transportation available to them. And so anyway, they give us feedback, and that feedback is gathered throughout the year, and then we share with you all their feedback via the engagement report.
Okay. So I'm going to wrap this item up, and here's what just a quick minute.
Would it be okay if we gather input from community, like a poll? How would you like to be engaged? So
Yeah,
to
yeah.
get feedback.
Yeah, so I'm going to wrap this up, and there's a couple of, I agree with what everyone has said, and this is really great input, and I would like to emphasize a couple of things that people said. I think it would be helpful for you all to think in terms of helping us articulate what metrics we'd want to measure, keeping in mind the kinds of metrics that Manager Valadez mentioned, as well as Manager Matwani, and help us work back from there and think in terms, I know you guys do this, and I know, so you can help inform us about how what you're doing leads to those metrics, and those are metrics that we can look at from time to time. So that's one thing. I think I would also like to emphasize that I do think it's important to get out in the community. I personally don't think they have to be formal board meetings. I think the community conversations, but I'd like to think in terms of community conversations that are specifically set up for the board to hear from folks, not other community conversations that we just happen to be at. So that, to me, that is one way for us to demonstrate to the community that we as a board want to be there and listen. So you might think about it that way. That might be a special community conversation or something like that. I leave it to y'all to give some thought to that. And then I think, I think that we just post all those events so that we don't run into issues around any quorum kind of stuff. But that's what I would invite you guys to think about, if you could do that, and then maybe come back to us. Oh, I also wanted to say that the idea of starting the board meeting at 5:30 makes sense to me, because it's a time certain, which helps us both in terms of letting the public know when they can do community input. I would pledge to everyone that if we do that, that we will do that in the context of not making our meetings go later. So to see what we can do to keep our meetings a reasonable time for all of us. But I do like that. And then that would give us the option, and I don't think we have to say right now, but it would give us the option to maybe, stream them on the Travis County, but maybe not. Regardless, I think
And it would be broadcast live, just to make sure, it would be a live broadcast.
Yeah, okay. It would give us that option, but it also, even just for itself, starting at 5:30, to me, makes a lot of sense. So that, I would just invite y'all to think about what everybody has said and then maybe come back
I
to
have
us.
a quick note about metrics. So
Okay.
all of our community engagement, outreach, and communications are based on metrics, and we
Okay.
report out to you regularly. Happy to reshare all that information. We can also add a metric for board accessibility and participation, which is what I'm hearing you ask for, and I think that would be really easy.
And also think about how your metrics tie with what Manager Valadez was asking about in terms of
Members, patient engagement.
Yeah,
Absolutely.
helping us
Which is what we
increase
report
enrollment,
on.
basically.
Yep.
Okay,
Sorry.
all right. Yeah,
Oh, yes.
all right,
Thank
thank
you for
y'all.
your time, everybody.
Thank you, this is very helpful, I
Thank
really
you very
appreciate it.
much.
Thank you.
Okay, so our next item is to confirm the next regular executive committee meeting date, time, and location. So managers, our next Central Health Executive Committee meeting is tentatively scheduled for Wednesday, April 24th at 4 p.m. or immediately after the Budget and Finance Committee meeting at Central Health Administrative Offices, 1111 East Cesar Chavez. At this time, I'm ready to accept a motion for adjournment.
I move.
Manager Musaitis, second.
I second.
I'm Manager Brinson. Okay. So we're going to move now to the Board of Managers meetings. Okay. Good evening. Today is March 27th, and it is 6:02. As a quorum of the board is in attendance, I'd like to call the meeting of the Central Health Board of Managers call it to order. The first item of business will be the consent agenda. On the consent agenda, we have 4 items related to the minutes, to ratifying investments, approving some actions that the Budget and Finance Committee took. Do I need to read all these out? Okay, and the fourth one, yeah, both of those, the third and fourth, are related to what the Budget and Finance Committee just did with regard to TxDOT and with regard to Hornsby Bend. So do I have a motion for the consent agenda? Manager Valadez moves approval of the consent agenda. Second by Manager Musaitis. All in favor? Aye.
Aye.
The item passes. Okay, we'll now proceed to the regular agenda. So managers, we were able to make some changes to the regular agenda in the interest of time to make sure that we had plenty of time to talk about that first item. So we are just going to take up the first item tonight because the second, third, and fourth items can be handled by just providing information to the board members. They're not items that at this time have anything new or require discussion. So we're going to go to the first agenda item, which is receive and discuss an introduction to Forces Driving Fiscal Year 2025 Emerging Priorities. Monica Crowley and Dr. Pat Lee will be presenting.
So just to tee this up, I want to acknowledge the strategies team, Monica and team, for organizing a really effective and a collaborative discussion where they pulled these observations out of the sort of heads of each of the executive team members and then carefully process integrated this. So you're going to see a sort of summation and synthesis of those key forces, and I'll let Monica present that to you and then hopefully open up to get your thoughts on whether we've captured some of the things that you're seeing out there, what we might have missed, and any guidance you have. This is, as we had said in the previous session, this is really the beginning of us understanding what then are our goals. What do we need to accomplish? What problems we have to solve for in this next budget season above and beyond our healthcare equity plan. And so this is step one, and we look forward to your thoughts.
And thank you, Dr. Lee, Monica Crowley, and just to ground what this conversation is, this is if you look at the March area on the timeline, This is our kind of first foray in discussing with the board these new driving forces that might lead us to need to have emerging priorities. So next slide. Thank you. I forgot we've all been here since the meetings have come back to back. We discussed the timeline in a previous meeting, but for folks that just are in this meeting, wanted to make sure.
And if I can just say one thing, just for our managers that recently joined us, the thinking is that these emerging priorities and our feedback on them will then lead to the priorities, additional priorities that we may want to discuss as part of the budget. So this is the first step along building the budget.
Yes,
okay,
so
thanks.
when we discuss the threats, the opportunities, new things that have occurred in the ecosystem since we developed the priorities in the healthcare equity plan, these driving forces are the factors that staff is considering, and that also with your input and capturing, additional driving forces, or if these are the appropriate driving forces, then any proposed emerging priorities would be based on addressing these threats and opportunities.
Okay.
So one of the areas, the teams internally at Central Health identified 4 kind of primary areas where there have been changes in the ecosystem since last year. One are general kind of changes in our healthcare landscape, changes that are both specific to our community, like the UT and Dell Medical School announcing that they are building to one specialty hospital and the MD Anderson Cancer Center. There also has been a more pointed and kind of more directed community focus on addressing homelessness in the past year that has come up. And then another, I think you can't dial into a continuing education or go to a conference now that's healthcare related that doesn't in some way focus on artificial intelligence and potential enhancement, safeguard policies that need to be developed for organizations considering artificial intelligence. Another area that staff focused on was workforce competition and market conditions. There is an increased competition for talent in Austin with not just the UT hospitals that are being built, but also the expanded 4 stories on the Del Seton Medical Center at UT, and then also new children's hospitals and other facilities that are being built in the surrounding Travis County region. There also is an ongoing affordability gap that impacts recruitment if you're trying to recruit nurses, if you're trying to recruit medical assistants, even if you're trying to bring residents and doctors into this community. If it's too expensive for people to afford to live here, then that creates workforce competition and market conditions to focus on that are a risk to Central Health completing its 7-year plan as it's building out its own clinical services and expanding as an organization. We have to be able to recruit providers and staff. Another area is in the data sharing and exchange ecosystem. One of the opportunities that is arising is the Texas Health and Human Services Commission is working with the at CMS in Washington on a directed payment program that is part of our 1115 waiver that really focuses on data strategy and encouraging Medicaid MCOs to make payments to hospitals based upon their interoperability and connectivity to local health information exchanges. So, and also potentially statewide health information exchanges. So there is an opportunity with this state push for payment to hospital systems to share information with health information exchanges in ways that haven't been paid for before. And then there also is the kind of risk in our community based upon kind of fatigue around interoperability challenges and data sharing, just kind of at the same time that this opportunity is arising with the funding from HHSC. And then there's just general regulatory uncertainty and funding policies. The federal election is likely to, depending on the outcome of the federal election, there may be changes in approach to safety net healthcare, and then also just how healthcare is funded in general. And then also there are opportunities coming up in 2026 and 27 based on the resizing of the federal funding pool for uncompensated care and some of these other supplemental payment programs. And those might create opportunities for Central Health and its enterprise partners to develop structures such as structuring our adult dental program so that we could participate in the uncompensated care program. So those were the things that staff focused on, but I'm really interested, as Dr. Lee says, in getting feedback on things that we've missed, areas that you think are kind of directionally appropriate, and things that we could add on or tweak.
Okay, so so managers, what we'd like to do is focus our comments on, do you have any comments on any of these that are proposed? Any concerns about any of them? Anything you think should be added, or just in general? So I'll open the floor. Who would like to, and I guess Manager Machwani, are you on? He had to log off? Okay, all right.
Want to start at one end, or?
Yeah, let's do that. Let's start this time over with Manager Jones.
I think you've done a good job of sort of highlighting some of the dynamics, forces that are changing. One of the things that I always think is important and that we look at is that of the demographics. One of the things, we talk about what is the percentage of those who are 200% of poverty or below in Travis County. If you look at the changing demographics of Travis County, the number of people moving into this county, what is that doing in terms of that number? And whether or not we are going to be, our population, other than those who are unhoused, are going to be further outside of our jurisdiction. And so I think as we look at that, we need to be mindful of that, because even some of these suburban communities within Travis County, affordability is outrageous. So many of them moving to outside of Travis County, I guess that's what I'm saying. And I would think that we might want to just look at that from a data point of what's going on in terms of the demographics.
I disagree with Shannon with what he said. I like what he said.
Okay. Manager Misaki?
I do as well. I'm just, in terms of following up on that growth, I think that is a driving force, and also the access, what we have, access to the care, the services that we provide. So is it matching up, or where do we lack? Thank you.
I would think in terms of, I'm going to go ahead and just say a few things right now. I really like the way y'all have presented this. All of these resonate with me. There's a couple of things that I might add or might want to think about or ask you to think about. One of them has to do with equity. Now, equity is not new, so it's built into our health equity plan. But I wonder whether the dynamics that are going on in our community allow for more emphasis there, or might allow for thinking about equity in some additional ways. So I would just suggest thinking about that. I'm curious that the data sharing is very interesting as a potential emerging priorities. I'm curious about data sharing with patients. I don't know enough about it, and I don't know if it's something that we need to think about. Because I don't know how much interest there is in it and what's available and that sort of thing, but I would just suggest thinking about that. I think another opportunity that's out there that's a sort of a dynamic is we might be in a time where our opportunities for collaboration and maybe trying some new things might be more available to us now. And I'm thinking in terms of we have the leadership of many of our major entities in the city have changed. With Dr. Lee, we have new leadership. We have new leadership at Integral Care. We have new leadership at the city. And we have relatively new leadership at medical school. So there may be, so I just invite you to think, well, maybe some things we tried in the past, maybe now's the time to try them again, or something like that. So those are the kinds of things. And then, of course, you already hit on it, the regulatory uncertainty. And of course, part of that is the funding uncertainty for us at Central Health. So we need to think about that also, or just be prepared. So that's the things I would add.
So when I think about artificial intelligence, of course, I think about the potential for data leaks and also distrust among certain levels of our community that may become very difficult for us to work through or regain trust with. So I think trust could become an issue, and then I'm concerned about how it feels that all of medical is becoming Central Austin, and what is happening to our patients if our patients are all moving to Round Rock or Georgetown. It just is concerning that it's all becoming so concentrated, and the traffic is about to really get bad, especially with the I-35 change. So just more worries.
Yeah, the I-35 change.
Yes,
Something
very.
we're kind of ignoring, but
Yeah,
that is
it's a big deal. Yeah, but the 10 years or 15 years to get there, oh my God.
Okay. Linda Valadez.
Shannon, you were in my brain. When you were talking about the changing demographics, and all of it due to unaffordability and age, because our senior population, the boomers, I'm there. Anyway, so those distinct populations that may or may not be Medicare covered should be of importance to us, including the children and those living with physical, intellectual, and mental and behavioral deficiencies. Should also be a target for us. So I'd like to see more collaboration with ADAPT, with PAC, with all these other entities that have their own distinct populations, most of which live on Social Security or on some kind of fixed income. And I agree with everything that's been said by everyone, and hope that we can take those numbers into consideration when we see a demographic report from Central Health that says we really don't have that many poor people, and there's nobody here, and they've moved out of Travis County. That doesn't mean that they're not there and that they're, to me, really not ours, because I think they still are in some way, shape, or form, at least with the region, at the regional level, with the Health and Human Services, and that we should take them into some of these situations into consideration, and the collaboration might also be with other governmental entities that are contingent, or not, what is it? Not contingent, but
contiguous.
Contiguous to Travis County. in some way, shape, or form, maybe through the LPPF situation, and making sure that those hospitals or initiatives that they're getting funded take into consideration the changes to their counties, because there are other counties that are contiguous to us that have failed to support even statistical information at the state level. I'm talking about Fayette County and other those, Lee County, which have historically not provided information that the state can take into consideration. So that means what happens to those populations which have relatives in our population, or we're all family, and Central Texas is impacting what happens here, it impacts what happens there. What happens there does impact what happens here. But I think y'all have done a good job in outlining this, and thank you to the board members that made their suggestions. Thank you.
Thank you. Manager Martin?
Okay, my turn. So I'd like to point out something which I think they all kind of wrap into each other. And that is the acknowledgement that our patients are moving further and further out. I think, first off, in changing landscape, as we've discussed in smaller groups, the importance, I think, of really entering into an alliance with UT to either construct a hospital. That would segue into funding because of the money we could pull down from the feds if we had that process going. I think it would address, if that were to happen, we have issues with acquiring workforce. I mean, it's already just in interviewing physicians to get here to move. It's difficult. And in light of that, sort of how would we perhaps find a partnership with outlying communities, which they're going to send their patients to us, right? And to establish some type of partnership with outlying communities to structure a safety net program as our patients get pushed further and further out. To me, the first and foremost thing is to establish an entity much along the lines of a larger healthcare district, such as Dallas, whatever. How have they worked these things out with the medical schools that have really led to excellent medical training and excellent community care it's affordable. But I think that has to be integrated once again with where are our patients going to end up? They're not going to be living downtown. And that has to be acknowledged in some sort of financing model moving forward for us. And I think that, once again, integrating a hospital with the UT health system to allow us to pull funds down would be enormously beneficial. That's it.
Okay. Thank you, everybody. I have two other quick thoughts to add questions. I would be interested in thinking about what's the dynamics around mental health, because I think that I don't know, it's just my impression that perhaps mental health is getting more attention now, and in terms of understanding how integral it is to a person's health. And then the other thing is the pandemic. I would like to know what we learned from the pandemic. That, when the pandemic first started, we all talked about how we were, or not we all, but there was a lot of conversation about we were going to learn things from it and we were going to change things from it. It feels to me now like maybe we learned some things, but now we're sinking back into the status quo. So I would just ask you to think about that a bit also. What's the dynamic? What's the dynamic of the pandemic that changed things or informed us, or something we wanted to learn from it that we need to think about going into the future? So, all right.
Chair Kitchen, in the spirit of dialogue, may I reflect back some of what I've
Sure,
heard?
go right ahead.
And see if if we're listening carefully, what I might have missed.
Okay.
Would you like
May I
to
just
please?
say one
Yeah.
sentence,
Okay.
basically one sentence?
Okay.
I think we were very slow to take into account what was happening globally. for the pandemic. There are some people, including myself, that thought it was going to be a hard hit, and we were not prepared. And then we were very slow to act. I was one of the people that was screaming in the streets. So I think that if, as we look at things globally and take those things into consideration, let's not act as if we have blinders on. Because, like as I said earlier, we're affected. What happens to us affects everyone else, just like what happens to them affects us.
Okay, would you like to reflect back?
If I could, yeah. And the first thing I'll share is I'm so glad we're doing this. I feel like even this around the horn here has offered some really important insights that I hope we'll incorporate into the view. But I heard 4 key points that are interconnected, as you said, Dr. Martin. So one is around the fact that the demographics are shifting. Our patients are moving further out, maybe even outside the county. That affects access, that affects how and where we build, how and where we reach people, and we need to understand. Imperfect as our forecasting may be, but we need to understand and fold that into our planning and our system planning together. I'll add as an aside that the FQHC we partner with, Community Care, has a different service area that includes some of the regional areas, and there may be interesting and strategic opportunities here to work together. Second main theme is around this window of opportunity, Chair Kitchen, I think you raised. New leadership, potentially collaborate across key institutions to really ask, how do we innovate, how do we collaborate, and how do we point that toward equity? What do we mean by equity? How are we sort of measuring that gap, communicating the meaningfulness of it, whether in human terms, health outcome terms, economic impact terms, and so on, right? And then this interesting notion of what do we learn in the pandemic, and I think that's a deep question, but one thing I think we learned in the pandemic is that under threat of a completely terrifying and overwhelming public health emergency, we put aside some of the things that keep us apart and we worked as one. We did that all over the country. And working as one, we did things together that we haven't been able to do before and that we're at risk of not being able to do after when we go back to our respective corners. So I think that's one key lesson that links to that point you made, Chair Kitchen. Now is the time for us not only to do things in the space, but to do things together, right? And take that longitudinal view. What does it look like to actually impact and break the cycle of homelessness or repeated inequities because the system is not there? How do we solve a system problem at a system level? And I think that's the challenge you're putting before us, which resonates deeply. And I think we'll try and reflect some of that here in our next step, where we come back with a revised version of the forces and then an initial version of the priorities that emerge in the forces. And so thank you again for the opportunity to have this dialogue with the board, and we're looking forward to the build this year.
All right, thank you.
Thank you.
Okay, I'm going to move on now to item number 5, which is confirm the next regular board meeting date, time, and location. Managers, our next Central Health Board of Managers meeting is tentatively scheduled for Wednesday, April 24th at 4 p.m. or immediately after the Executive Committee at the Central Health Administrative Offices, 1111 East Cesar Chavez. At this time, I'm ready to accept a motion for adjournment. So moved from Manager Valadez, seconded from Manager Brinson. All in favor? Aye. Okay. Thank you very much. This was very helpful. A very good, I felt like we had some good conversation.